Hi, my name is Dr. Mike Bollinger. I'm an orthopedic surgeon. I've been practicing in Sebastopol since 2002. I came to join Dr. Campbell after my training down in LA County USC Hospital. Since then, I've been practicing general orthopedics here in Sebastopol. Dr. Campbell retired in 2006, but we've continued his good work here in Sebastopol since then. As my practice matured here in Sebastopol, I began to have more patients that needed hip and knee replacements, and I was unsatisfied with the status quo of the standard hip replacement. The way I was trained and the way most surgeons do it in the United States is through a posterior approach, and there is associated with this a higher pain incidence, dislocation rate that I felt was unacceptable, and a longer recovery period than what could be achieved through other methods. So I started looking into other modes of doing this surgery, one of which is through an anterior approach. It was a fairly new approach when I was looking for these alternatives in around 2006. I found someone who was doing that approach and went and did some training with him, and then did some subsequent courses to learn how to do this and become more facile with this technique. We began doing them at Palm Drive in the fall of 2006. It's a much improved way to do this surgery. Significantly decreased pain, a more rapid recovery time, virtually a 0% dislocation rate. We've been very happy with this technique. Initially, when we were doing the technique in 2006, we weren't using the special table that we now have. It was quite a bit more difficult. Due to the generosity of the community, a table was donated to Palm Drive in 2007. Since then, we've been doing this anterior approach exclusively with the aid of this table, and we've been very successful with it, both our patient satisfaction levels, their ability to get up out of bed with much less pain, don't have a fear of dislocation, bending over, crossing their legs, all that's fine. People can do yoga. They're very happy with their result, and therefore so are we. People are able to get out of the hospital much more quickly, which is good for them, obviously. And in general, it's been a very satisfying procedure for us. In addition to anterior hip replacements, the table also facilitates other new and fairly unique surgeries to our area. The main one being hip arthroscopy. That's where we put a scope in the hip joint and allows us to treat problems with the hip that don't require a hip replacement. So if someone has hip pain but not bad arthritis, that can be due to other problems such as having loose bodies in the hip or a tear at a structure called the labrum that can now be fixed with this new procedure. We're one of the few places in the North Bay that does this, and we're very excited about that. The new Sonoma West Medical Center will have these techniques available for the patients in this area, and we're happy to be able to offer those. I'm very excited about the Sonoma West Medical Center. It's an interesting experiment in modern medicine where doctors and nurses and administrators are all collaborating from the very inception of the hospital to really make it a unique place to provide medical care. It's going to be a very cohesive group of doctors and nurses and administrators, as I've said, that are going to allow us to perform unique procedures for patients, hopefully take care of the whole patient and not just one part of a patient at a time, and really be creative in the way that we perhaps do some research on some of the techniques that we're doing, and hopefully be able to expand on the care of medicine in the West County and maintain the high caliber of care that we've been able to provide in the past, and maybe even bring it up a few notches if possible. And it was that feeling of community spirit that made Palm Drive a special place. The nurses work there because they like to work there, the doctors work there because they like to work there, and that really reflected in the way they took care of their patients. That was the universal thing that people would say. They really loved that little hospital, and it was not the building. The building was nothing special. It was the people that worked there and their obvious caring that they then translated into the way they took care of their patients.